And you are now live.
All right. Thank you. This is Senate Appropriations, and we're continuing our work on the budget adjustment bill. And this afternoon, we have witnesses from the Department of Mental Health to present to us the request that the department has in the budget adjustment. So, Commissioner Haas, I guess this is your first appearance before this committee. And so if you want to introduce your staff and that you have with us, and then I'll leave it up to you in terms of whether you're doing the presentation or whether you're asking one of your staff members to do that for the department. So welcome, and look forward to having the introductions.
Thank you. Good afternoon, Emily Haas, Commissioner for the Department of Mental Health. Allison, do you want to introduce yourself real quick?
Yes, good afternoon. Allison Krampf. I'm the Deputy Commissioner for the Department of Mental Health.
And Shannon's a familiar face.
Good afternoon, everyone.
Good to see you again.
Nice to see you as well.
Thank you. Oh, go ahead.
No, we'll turn it over to you in terms of however you want to organize your presentation.
Sure. Our plan is to have Shannon Thompson start us off and start working us through the talking points that I assume folks have been able to receive at this point. So Shannon, if you want to go ahead and lead us off.
Sure. Thank you. I understand that from Rich Donahue that did you want the presentation to be shared on the screen, or do you already have it so you don't need to?
Well, I think at this point, maybe it's better to share it on the screen. Committee? Okay. Well, why don't you put it up? Because I know sometimes Alice is trying to do it off her phone and it makes it hard. So why don't we have you just screen share?
Okay. Are you seeing?
It's starting.
Yep.
Yes.
Okay, great. So the first item on the list is around the incentives for VPCH, the Vermont Psychiatric Care Hospital, and MTCR, the Middlesex Therapeutic Community Residents, for staff incentives. We have proposed some staff incentives for fiscal year 22. And there will be some residual cost that will flow into fiscal year 23. And it's my understanding that these have been negotiated and these are the final results of the negotiations. So we're proposing the staff incentives for recruitment and retention purposes because of staffing shortages at the inpatient facilities. As I mentioned, there's funding to cover both FY22 and FY23, fiscal year 23, that we intend to carry forward as one-time funds. That's kind of our approach to that one. Would you like to go through what those incentives are? I'm happy to do that.
I think it probably would be helpful. We did do that for the incentives that Department of Corrections asked to have funded.
Sure.
So if you just want to scroll through them quickly, that'll be great.
Okay. So for non-probationary probationary employees on the first payroll that started, I believe, last pay period maybe, will receive a lump sum of $500. The non-nursing, non-probationary employees who receive the $500 above, who remain continuously employed for the last pay period through June of 2022 will receive the next lump sum of $500. So that one will hit in 23. It'll hit in July. Then for non-probationary nursing staff who receive will receive $500 above.
So they got the 500 above, and then they get
then they'll get 2,000. Exactly. Okay. I apologize.
So rather than the first non-probationary, they got 500 and then 500. Nurses would get 500 and then 2,000.
That is correct. Yes.
Okay.
So similar arrangements for folks who are in their original probation, those hired on or after January 4th of 2022 will receive the lump sum of 500. And then after successful completion of their probationary period, they will get the remaining $500. And that the same for the nursing staff, they'll get the initial $500. And then once they complete their probation, they'll get $2,000. In addition to that, we have shift differentials for the facilities. Most folks who are doing
You're going to need to scroll. You need to scroll
Apologies.
down.
Okay. We have some folks on 12-hour shifts and some folks on 8-hour shifts. So there's a different shift differential for the day shift, the night shift, and the weekend shift, depending on whether you work 12-hour shifts or 8 hours.
You need to scroll your memo down or your summary sheet, because we can't see below non-nursing staff.
My apologies. It looks different on my screen. Can you see it now?
No,
Maybe it's just stuck.
I don't know.
Okay.
It looks
Interesting.
like Senator Starr when he's not stable. He just stops moving. We're stuck at non-nursing who received the 500 above. That's the last line we can see.
Would you like me to try to share my screen and see if we're successful?
That would work.
That would be good. Why don't you try it, Chrissy?
Okay, great. So Shannon, if you can stop share, I'll try to give it a go.
Okay. I am going to, so I'm going to attempt to do that. I'm not sure now.
I think I can do it for you. Okay, there we go.
There we go. Thank you.
And give me one
I'm not
moment.
used to Zoom. I use Teams and Zoom is a little different.
Okay, can you guys see that?
Yes,
Yeah.
it's really good.
And tell me where you got, I would like me to,
The 12-hour shift.
Thank you, Chris. I appreciate your help.
my pleasure.
So down further.
We got to go a little further.
There we go.
Yeah.
That's a
Yeah.
little bit more. So those are the shift differentials that are being offered. And that's in addition to what they're already getting paid for their shift differentials.
So that's an hourly add-on.
Yes.
So $6 add-on per hour for the night shift. It's probably, since this just implemented, it's too hard to tell what the impact has been. Could you tell us what the baseline is? In other words, what has been the experience in terms of what has been your vacancy? And are you in other words, help us understand the severity of your staffing situation that has generated the need to make these additional payments.
Sure, I'm happy to answer that. So the VPCH and MTCR hover around 53% vacancy rate. That's been steady at that level for quite some time. That primarily is in the nursing department. So our other ancillary positions are almost totally filled at 100%. So that 53% is specific to the nursing department. The shift differentials and both the $500 bonus or incentives, we haven't been in play long enough to know if it's significantly impacted our recruitment. We do know that has made an instant positive impression for morale with the shift differentials specifically, and brings us closer in line to other healthcare facilities nearby, like Central Vermont Medical Center, and what the individuals over there in similar departments are being paid. So we hope to know more in the coming months of the positive impact for being able to fulfill some recruitment goals we have.
Thank you. So the 53% is the vacancy rate experienced by the subgroup of nursing employees. It's not 53% of the overall workforce.
Well, The nursing department is the largest department at the, at both facilities. So that 53% is not going to change too much when you add in the other departments.
Okay, all right, thank you.
You're welcome.
Could I ask a question?
Yes, you may, Senator Starr.
Yeah, I'm wondering, is there anything about call outs and these raises, or are they still going to get paid even if they call out and don't show up?
Well, people don't attend a shift for a variety of reasons. So if somebody just doesn't show up, they would not be paid for that. If somebody calls out and is sick, or for some other reason, I'd need to loop back to you for the specifics. But I believe that the shift differential happens if you actually do the work. But I can follow up and just double check on that.
Yeah, thank you.
You're welcome.
I would think that would be very important that they show up if we're gonna pay them all this money or give them these increases. They ought to at least show up.
Yeah, and that's the purpose, and specifically for the overnight shift, or the knock shift. That is the shift that is the most difficult to hire into and to get volunteers to move into that shift. And so you'll see that shift differential is high, because that's one of the most difficult positions to hire into. That's where we're seeing a lot of our vacancies.
So if you work the night shift on a weekend, then it would be $8.
Yes.
Okay. Other questions? I can't see anyone. All right, we'll keep going. I don't see any questions on that, so.
Okay. So the next item on the list is some startup cost for the 16-bed residential facility that is slated to be open sometime in the early spring, late winter, or early spring of 2023, I believe, in the January to March timeframe. So DMH worked with BGS and to accumulate all of the costs for the new facility. This cost was included in the budget submission to the Green Mountain Care Board. However, this portion of those costs is not something that would be part of the capital budget. This money is for all of those items that are not built in. So things like additional chairs or office equipment, maybe mattresses. A lot of the furniture is built in. So we are not anticipating a lot of need there, but we did want to put $150,000 in the fiscal year 22 BAA so that we can then carry forward that money into fiscal year 23 as one time. Do you have any questions on that?
So it really, you want to put a fence around this money so it can be carried forward into 23, but it's not because you have an expenditure in this fiscal year.
Well, we don't anticipate spending a lot of it this fiscal year. There may be some items that have a long lead time, some items that we need to start purchasing. And sometimes when you do that, you have to pay a little bit up front. We just wanted to have that money, yes, accessible for us in 22 if we need some of it, but also because it's one time in nature. This is how AHS wanted us to approach getting that into the budget so that we can then carry any remaining funds over into fiscal year 23. It's my guess most of it will be spent in 23.
Okay.
So this is the Children's Crisis Supports. Jarrett House is a 16-bed children's crisis facility that is really suffering from staffing shortages, and they're unable to keep the beds online. This is an effort to provide additional funding to cover the cost of travel partners. So I think Jarrett House and Commissioner Haas and Deputy Commissioner Cromp can elaborate more on this if you want, but I believe currently it's only open 5 days. because of staffing shortages. So this would help in the recruitment efforts, hopefully, of getting some nurses online so they can get those beds open. But I'll defer to our commissioner.
I have a question.
Yes, I thought you might. Could you just tell us where Jarrett House is located? And then Senator Sears' question.
It's a 6-bed facility. It's part of the Howard Center, so it's in Burlington.
All right, thank you. Senator Sears.
What is the duration of the travel partners, or is it already started and this is just to pay for it?
It hasn't started yet. They have been unable to locate or hire and recruit an appropriately skilled travel partner to come into the Jarrett House. But typically a traveler contract is anywhere from 6 to 13 to 26 weeks, depending on the certain facility.
My understanding was the contract, at least talking with DCF, their contract is up on either I think the 31st of March.
So
Okay.
I'm wondering the duration of the 225,000.
Dick, DCF's contract is with a contract nursing, or is it
Travel
could you-
partners type of thing.
Yeah, all
Traveling
right.
staff, I know down at on the Depot Street programs, they have a number of travelers right now that are augmenting the staff. They have the same crisis everywhere.
All right.
Commissioner
And
Wong.
is
Oh,
this
go
a
ahead.
is this a residential facility?
A crisis bed facility. So unlike a residential, which is longer term, this is designed to be shorter term, anywhere from 3 to 10 days.
Okay, but it's not a day program. It's people, it's short term, but it's
24/7.
24/7. All
overnight.
right, thank you.
Have you been working with DCF on the crisis? Particularly as it relates to the Southwest Vermont Medical Center?
Yes, I can speak to that. I just had a meeting with Commissioner Brown and the Southwest Vermont Medical Center, and we are setting up follow-ups to that meeting. And it's going to take all of us to try to figure that out.
It's a crisis, and we have staff being assaulted at the hospital, staff being assaulted in the group homes. We actually have DCF staff being assaulted. And many of these kids have significant mental health issues that then become delinquents because they assault. And I think the system is in deep crisis, and I don't see, I realize we've got a pandemic. I realize we've got all these other problems, but we are not dealing with this. And I appreciate that you're going to try to help with Southwest Vermont Medical Center. But when kids are housed at an emergency room, and as I understand this emergency room for these patients, there's no windows. It's like solitary confinement. They're with perhaps 2 or 3 other people in the room to try to help calm that person, as well as security. And the assaults have been going on. I hope you will take back to the Secretary of the Agency of Human Services that this crisis needs to be dealt with and can't wait a year to figure out whether Newberry is going to take 6 kids or not take 6 kids. And I don't think it's just, I think it runs the gamut from corrections to mental health to DCF to Dale. All the agencies need to get together and to deal with this crisis. I was shocked at some of the things that I used to run the Depot program. So I'm not easily shocked by what kids do, but I was shocked by some of the behaviors that they're being asked to deal with in the Bennington community without the necessary backup. And they're having the same issues, and I have no problem with your support of the Jarrett House for the travelers, and any salary help you can give those people is great. But everybody's having the same problem, and this, quite frankly, I'm not criticizing you because you're new to the position and all that, but I don't see the Agency of Human Services responding to this crisis in the way I think they should be.
We may be getting, we haven't had DCF in. I don't know to what extent they're proposing increases for salary or compensation. We know that what state operations are experiencing in certain areas are being experienced by the programs that are operated in the community. And so we need, one of the things we're trying to better understand is, yes, it's nice that we're supporting the state administered facilities, but what will be the response to the community-based systems that are grappling with the same workforce, the same staffing demands, and what does that look like in a comprehensive way? So it's hard to, we're getting it department by department, but I think it's only just a small slice of really what is being experienced out there. And certainly what Senator Sears is talking about is the immediate need for some of the kids that are in that are the state's responsibility, and how well we're addressing that need. And unfortunately, it sounds a bit like what happened with mental health crises that end up in the emergency room for prolonged periods of time, more by default than because it's the right place to be. So I think this is only the beginning of that conversation, because it extends beyond mental health, but certainly mental health issues transcend multiple programs, multiple departments, and it's going to take everybody's best thinking to figure out the response. So that's what you're hearing from us, is that concern about where we are, but we have to have something much more aggressive, much more deliberative, and something much more immediate than maybe at the end of an appeal, something will be available. So you're just hearing sort of the collective concerns. Yes, Senator Nitka.
I'm just wondering, what is the age range of children that can go there? And can you take a child who has mental health needs who might be a delinquent in custody? I don't know if that's...
Yes, they certainly take children and youth who are in DCF custody, and they go up to age 12. So it's for younger children.
Okay. Thank you.
Okay. Why don't we keep going? The suicide prevention.
Yes, so this is $440,000 for to maintain the 988 suicide prevention line. DMH leveraged a couple of federal grants to build the in-state capacity to answer calls to the National Suicide Prevention Lifeline from Vermonters. That ended in September 30th of 2021. Through that work, we've successfully improved from an in-state answer rate of 0% to Vermont callers to the Lifeline in 2018 to 76% answer rate as of August of 2021. The goal is to hit 90% by July of 22. So the federal funding went towards onboarding 2 Vermont crisis centers who became certified by the National Lifeline, Northwest Counseling and Support Services, NCSS, and Northeast Kingdom Human Services, and NKHS. So the total funding through these 2 particular grants was $270,000. The in-state call response provides Vermont callers with referrals to local resources such as mental health counseling, economic or housing supports, which can help them manage life stressors that may be contributing to suicidality. So on average, there were about 245 Vermonters
We
call
need
the
to s-
lifeline during a month. I'm sorry.
And Jane, is that money split evenly between the two agencies?
Well, I don't know. Why don't we ask?
It is not split evenly between the two. I believe Northeast Kingdom has a little bit more because I believe, and Allison, please correct me if I'm wrong. I believe that Northeast Kingdom has some additional costs due to shift differentials or a different pay structure. I'm not sure if you
They
can.
cover more hours.
Okay.
So yeah, Northwestern Counseling covers a shorter amount of time, where Northeast Kingdom does weekends and overnights.
Thank you.
Thank you.
All right, 988. So that's why we have to dial 1802 now, because that is the 3-digit for suicide.
To clarify, it will be starting July of 2022. So right now it's still the 1-800 line, but it will be shifting. And so yes, that's why you got that message on your phone. Shift.
Can I ask a question?
Yes, Alice.
I'm looking at the explanation here, and it says provides the callers with referral options to other resources. What about someone who's in a crisis trying to get an answer from the person who answers the phone and they're on the bridge or something? Does this line help them, or do they then have to call someplace else or get connected to another place?
That's a great question, Senator, and we should update this language because that is the number one service that they provide is response in the moment, 24/7. It has to, a person has to answer the phone. It can't go to like any type of answering service. And so that is their number one of what they provide. And then there's an opportunity. And for a lot of folks that are not interested, they're calling to talk to somebody. They're not calling to get an appointment in a week.
Right. Okay.
But if someone appears to be in immediate danger, then I would assume that the staff then would immediately notify like public, the law enforcement, the local entities that could go and hopefully intervene in a physical way as opposed to over the phone.
Luckily, that's not coming up that often, but they are available to do what we would call an immediate safety response. And that's done through the local crisis team. So, yes, at times that involves police. We do try to avoid a police response unless absolutely necessary, but a face-to-face is absolutely the next.
Okay. Other questions? Is that the last slide or are there more to come?
There are a couple more.
Okay.
We have some net
here's
neutral.
your answer, Senator Starr. We only had to get to the next.
Yeah, I see that.
Yeah. All right. Okay.
Okay. So this next item is to transfer $13 million to the Department of Vermont Health Access, Diva, for the Brattleboro retreat. This is to cover the new alternative payment model. Currently, DMH pays for, or prior to this, DMH was paying for level 1 and CRT inpatient costs. And now that is being done through Diva using the alternative payment model that we have created. So in early 2021, DMH and Diva began working together to establish the alternative payment model for the Brattleboro retreat and in an effort to stabilize them. The model began on March 1st, 2021, and pays the retreat a consistent monthly payment that's to be reconciled at the end of the year to their actual utilization. So if they don't provide all of the beds, there are some nuances to it, but we reconcile at the end of the year. So the Brattleboro retreat consists of all psychiatric inpatient hospital beds for children and youth, which have traditionally been paid for by Diva, as well as the non-level 1 now and CRT adult beds.
Janet, if you could bring us up to date, we actually put money in to remodel a building at the retreat. to expand, I think, crisis beds. I think it was crisis beds, maybe
I
not.
think it was level 1, maybe.
Oh, that's what it is. Are those, and I know that getting staffing actually delayed. Could you just give us an update on, are those beds ready to go, except for staffing? Or have any of them been brought online into the system?
Shannon, I can answer that. That is also referred to as the Lidded Lodge. And that unit is open and serving folks. I believe they have 7 individuals admitted to that unit. I think staffing still has an impact on getting up to, I think 12 is I think it's a 12-person unit. But they are at 7, they are open and operating and have been for a few months.
Oh, thank you for the update.
Quick
No
question.
Oh, Senator Sears and then Senator Burris.
Yeah, am I to understand at the end of the year, the retreat might have to pay back money or get more money? And if it's payback money, where would you expect that to come from?
That was my question as well.
Okay, the reconciliation, what happens if it's the money's owed?
Yes, so it could go either way. You're right. There are some parameters in there where if they serve a certain number, a certain percent above, then we would give them more money. And as well, if they go below a certain threshold, there could be the potential for a payback. There is also some language in there where there's a little bit of flexibility in that if they it's tied to some denials to the level 1 beds. And if they don't deny and they still have low utilization, it increases that threshold to a much bigger number so that it minimizes their risk of payback. So there are nuances in the contract around that. There's also some flexibility when something catastrophic happens that is out of the control, such as COVID, that is out of the control of the retreat. So it gives us a little bit of flexibility, but at the end of the year, there is the potential that they would need to pay back for underutilization.
I would just
I
add,
think that they would have the money to do that.
so I would just add that we don't wait until the end of the year to look at that. And so we're meeting with them monthly and looking at their financials. And so as those prospective payments are going, they're getting a good sense of if they're drawing it all down or not. And so if they're not, we wouldn't want them to expend that money somewhere else. We would want them to be aware of where they're marching towards the end of the year.
And are they currently taking kids?
Yes. Right now they
'Cause
have,
my impression was they've been closing intake because of COVID.
yes. So they, on their kids for the retreat, there's the younger unit and then the adolescent unit. They have been able to take a child on the younger unit. The adolescent unit is where things are stuck right now. They're hoping after this weekend, they'll be able to open that back up.
I hope so, because that just exasperated the situation that we were discussing earlier.
Yes, thank you, Allison, for pointing that out. There are conversations, monthly conversations with the retreat, so that we're all aware of where things sit.
Okay, thank you.
That was your question as well, Senator Baruth.
Right, whether there would be some kind of clawback that would put them in a shaky financial situation. But I think that's great if you're meeting monthly with them and reviewing the progress of their financials.
I do know that those alternative payment methods, when we were talking about provider stabilization, at least for the DAs and the SSAs, they were saying it really gave them financial stability more so than if it had been fee for service, which would have really been a devastating but there's, like we talk about risk corridors, I guess there's utilization corridors that are in this grant, in this contract, so that if they go above or go below, then it kicks in either way. So, but it's nice to know that this is not going to be a big hit at the end of the year, that in fact this monitoring and truing up, or understanding what that true up might be, is an ongoing process throughout the year. Other questions? Otherwise, we'll get down to NFI.
Okay. So this is another transfer of funds to Diva to support a new rate for the NFI hospital diversion program. So Diva currently pays the daily rate for the hospital diversion, and we, DMH, worked with Diva to come up with a rate. They hired Burns and Associates as a contractor to assess the cost of the program and to help us determine that the current rate really didn't cover expenses. So we, DMH, who currently supports the program, or did support the program with $160,000 of investment money, global commitment investment money, as well as another $52,000 towards an incentive payment. We took all that money and we are giving that to Diva so that they can put that in the rate to support that higher cost. So they don't have to wait for the $52,000 to earn the incentive, and they are not getting the 160 as a separate payment. It's all going right in their rate, and it increased the rate to cover the cost at the time. Any questions on that?
Any questions? No? Okay.
We had one more item. The $430,000 for the level 1 cost settlement. That is also a net neutral transfer from AHS to DMH. So there are currently 2 level 1 hospitals, Rutland Regional and Brattleboro Retreat. And as of the end of last year, there was a potential cost settlement of about $430,000 that we knew was going to occur in this fiscal year. So AHS was able to secure that money and carry it forward. And now they're putting it in the DMH budget because we did in fact get that cost settlement from the Rutland Regional Medical Center. Any questions on that?
Okay. Don't see any, or any voices. All right, so I guess we've finished the slide. This is the last piece of the request of the budget adjustment request.
Yes.
Anything else? Why don't we, I want to go back. In the larger, maybe it's in the AHS, there's money for recognizing staffing costs in the designated agencies. And I recollect a figure of 2 million was talked about, but maybe there's more in the BAA too. I wondered if you could speak to that as well.
Sure. In December, 2 million did go out to our designated agency SSA system, targeting individuals working within 24/7 positions. We identified those groups of folks as sort of, I think they asked us to stop the bleed. And so we identify that those crisis positions are a big piece of that, and making sure that folks aren't getting to the emergency rooms. So that 2 million went out in December. I know that AHS has a very robust presentation to give. And I think Ina Backus is the point person for that for AHS and our workforce plan. And DMH works collaboratively with them and the other departments to put that together.
I think probably you're referencing the 33 million package. And I do think In fact, our colleagues in the House had the same response we did and thought that that was probably not adequate. So I'm anticipating that when we get the budget adjustment, it will be more than that. We're hearing from all over, from our residential care providers to, for adult day programs to, the SSA. Some of them are talking about 50% vacancy rates, triaging who gets served. So it's a very difficult situation right now that is occurring. So I just want to take your comment about what the agency's proposing back to what I think we're going to be seeing when the budget adjustment comes from the House. And I know that Vermont Care Partners has been putting, a number of articles out in terms of the, the staffing situation that they are struggling with. But it's everything from, from our group homes to, you just name it, it's just pervasive. And it's everywhere, from not having sufficient sheriffs to provide the security at our courthouses, to our nurses, to, correctional guards. It is a very, very difficult and serious situation right now as it relates to being able to serve and provide essential services.
Yes, I would agree with that. We're all in the middle of that. It will be all hands on deck to address that.
Okay. So I'm sure that we'll have more discussion on that front. Other comments or questions on the part of the committee? Bobby, are you waving your hand there, or is that your cat?
No, that must be something else.
Oh, okay.
Maybe I was waving goodbye or something. I don't know.
Oh, all right. If there are no more questions of the folks from DMH, we'll let them get back to their work. And I'm sure we'll be having a much more detailed discussion as we get into the budget for 2023. So thank you. And at this point,